Today I'm going to talk about a case scenario where a child, let it be a 7-year-old child, who comes with a limp. So the most important thing that we can do is to take a good history. In history, first of all, you will ask name, age, and after that, in your history, the important thing you have to ask is whether it is painful or painless limp. And if it's painful, you have to know where is the side where it is painful, for how long has been there, the pain, for how long, the duration of the pain, and referred pain. We have to remember that the pain can also be referred. For example, coming with the knee pain, it can be referred pain from hip or the spine, the lumbar. Or we have to know the etiology. So in a limp, the etiologies according to the age groups are in toddler, in children, in adolescents. Etiology can be infectious, traumatic, congenital, neuromuscular, and can be inflammatory. It can be inflammatory too. Other etiology can be inflammatory. Also, it can be because of blood disorders like hemophilia. It can be because of sickle cell, and it also can be because of neoplastic. We have to remember the basic pathology for the etiology, and then you can exclude the DDs. Then you can look at this table and remember some few causes of infections: traumatic and congenital and neuromuscular, as well as for neoplastic, inflammatory, hemophilia, those things as DDs. I think you can go through this chart later. And also I've added another chart where you can see if it's the etiology, traumatic, infection, inflammatory, neoplastic. It can be also perthes, slipped capital femoral epiphysis, SCFE, can be congenital hip dysplasia, neurological, or discitis. With age, onset, if there's fever or not. On infection, there should be fever, but in inflammatory tumor and in discitis, there is sometimes fever. And pain, there is pain in all except for neurological, there is no pain. And for swelling, we have in inflammatory, yes, and rest this one, no. And sometimes in traumatic, infection, and tumor. And range of movement, except in discitis, everything has loss of range of movement. And going on with how to work up a limp, remember that anyone coming with a limp will have an antalgic gait. And we have to, in history, as I told earlier, we have to know if it was traumatic or overuse. If no, is there any systemic symptoms? If no, then knee or thigh pain. Examine the hip, can be referred pain. If there is hip pain, then it can be slipped capital femoral epiphysis or Perthes disease. And normal hip, there can be acetabular or discoid lateral meniscus problem, so that's why we do radiography. And if it's the hip pain with the Perthes and slipped capital femoral epiphysis, here also we can do the radiography. Then that's it for this part. And if there is no systemic symptoms, we went through this. If there is any systemic symptoms, we have to do first of all the investigations, radiographical, full blood count, ESR, and CRP, inflammatory markers. Then after that, we have to see if there is any bone pain. If there is any bone pain or tenderness, then after that, if there is any bone pain, if there is elevated WBC, ESR and CRP, can be osteomyelitis, do MRI. If there is any pain related to strain, pain at night, palpable mass or constant intermittent pain, can be neoplastic osteosarcoma, Ewing, also do MRI. And if there is neutropenia, decreased platelet anemia, can be hematological leukemia. And if there is trauma, as we discussed earlier, it can be acute traumatic or because of overuse. Can be because of fracture, toddler's fracture, soft tissue injury, foreign, and it can be also radiographical. If it's overuse, then also we go with severe disease or school shatter. You can go through this. Also here radiographical. So we will finish this part. So you can also go through this. If a person is having hip pain, let me choose another color. Having hip pain, elevated WBC count. Here there was bone tenderness. Having elevated WBC, ESSCRP, septic arthritis, and transient synovitis. You have to remember one thing about transient synovitis and septic arthritis in emergency. Septic arthritis and transient synovitis is usually an post-viral syndrome. Usually it is seen after post-viral infection. So in history you can ask about any viral infections. For this you can do joint aspiration and culture. And then the other thing is, if there's positive Patrick Faber test and tendrosarcoiliac joint, then what you can do is you can think of any sacroiliac infection, MRI. Positive psoas sign can be psoas abscess, do MRI. Pelvic bone tenderness, pelvic osteomyelitis can be, so do MRI. And going on with the back pain or spinal tenderness and vertebral osteomyelitis or discitis, also do MRI. And going on with this, I think this is the workup plan for your limb. If any child comes with limp, I will erase this so you can like go through this flowchart. It's really good, and I hope that you guys found it helpful and you will remember this flowchart so that it will be useful for you to like exclude the DDs.